blocking straight, and then later I'm going to block in those little volume. At first, not 100% straight though, it's kind of maybe going out at an angle like this, right? From here, the center of the testicle, I go down. Instead of straight, I go slightly at an angle like this, right? And I want to stop here at the level of the top of the knee, because from here, I have this other change of angle here like this, right? I don't want to follow the profile though. I want to follow the volume, right? The volume of the thigh. So this is going to come in at an angle like this, and I know the top of the knee here, right? Top of the knee is here. When I get a little bit higher than the top of the knee, see this is a change of angle here, right here. And from here, now I block in the side of the knee, which is straight, like this, right? So basically, look what we did, right? With 1, right? 2, 3, right? 1, 2, 3, 4. So we want to break down this line here. We don't want to draw them as curve like that. We want to draw them as segments. 1, 2, 3, 4. Because they are measurable. Because they become measurable, right? So then, this is going to be the top of the, this is the tendon of the rectus femoris and vastus lateralis here. This is the flat portion like this, right? And this is the patella here like this, right? So now on the side of the patella here, I have this side, this tendon of the bicep, this side plane like this. And here, starting from the top of the patella, goes in, right? In, that is the inside of the box of the knee. So we're going to see these things quite a few times. So you will have time to review and revise them. We have time to become familiar with these. So let me block in here a diagram of the thigh, just we see the different angles in plane, right? So the thigh, we can block it in as a volume like this, right? That is tapering, like this, right? And this is the pelvis, right there, right? So this is the inguinal ligament, that's the genital, right? The peak of the trochanter is about at the level of the peak of the pubic bone. Here, down like this, right? I'm going to have this, the box of the knee. So the box of the knee has the lateral side straight, the inside here is at an angle. Then we have now, that's the box of the knee. So half of the box of the knee, which is at the end of the femur, is where the patella is. The other half is at the end of that is the tuberosity of the tibia. See that? The V. So now from here we're gonna block in the direction of the leg, right, the lower leg, which is slightly angled like this, right? Along this line here, right, this segment here is similar in length to the top, which is fine. Now here I block in the volume of the calf. See that here? And below this I block in the tapering. See the tapering of the lower leg? Truncated cone, upside down truncated cone here. And down here, I have a swelling of the ankle, and now it's an upright truncated cone, and then the foot. So now I have the leg, right, here with the thigh, and the box of the knee, right? So thigh and box of the knee. Calves, right, the volume of the calves, and the volume of the lower leg, which is now slim, and the foot is going to be here, this wedge here like this. So now I had to go down like this to this point here, right? So I have the general direction of the leg, right? So what I can do now, I can check how big this is, more or less, right? This volume here, the calves, is occupying a little bit more than half of the space between the box of the knee and the ankle bone. So a little bit more than half this, right? So I'm making a volume here like this, right? Below that, I'm gonna do the tapering. See that here? See that, the tapering, right? Now that I have the tapering, now I can refine this, right? Can refine this a little bit more, right? So let's see. This side, right, the side of the bicep is kind of in the middle of the height of the patella. Here, stops here, right? This. From here, I have a peak. See, it goes out like this, right? Peak here, and then from here it turns and it goes down like this, right? So 1, 2, flat, and 3. And this is now flat, the lower leg, right? We'll do it again, right? So what is this change of angle? See, that is kind of in the body of the patella. Before I make it skinny, I want to work on the inside so I can compare the width of the leg with both margins. Right? 1 here, see that? 1, 2, 3, right? Here, 1, 2, and also look into the negative space, and 3. And then I have the fourth line that goes toward the top of the patella here. Yeah, it's a little bit chubby, right? I'm gonna make it skinnier. Just not much, but a little bit, right? So I simply move the whole profile a little bit to the left and keep it less angle to the right, and taper a little bit more. Okay, that looks better, right? A little bit more like that leg, right? Now here I have the, from this point here, I go out and then in for the box of the knee. This is the box of the knee, see that here? This is straighter, and now I have the same thing. I have the angle of the leg, right? I need to shorten it up because so the toes are sticking out. The heel is higher than that. So that's the heel. So that's the end of the foot. That's the heel, right? Here. So now between the heel and the box of the knee, I'm blocking the volume of the calves here. See that here? And below the volume of the calves, I have now the tapering form of the lower leg. And then, so the upside down truncated cone, see it here, right? And then below here, I have the upright truncated cone for the malleoli. And the foot, they will develop down like that. Right? So this needs to protrude like that. That's good. Maybe more. That's the knee. That's the heel. And that's the toes. I need to move the foot a little bit to the right, which I can do, right? And then I have the V here, the bicep kind of wedges in between the extensor and the flexor right here. And where is that wedge? It's a little bit higher than the iliac spine is here, right? So I'm going to block in this volume here. I'm looking just at the angle of this line here, the inside of the arm, and the negative space that I'm blocking here. And then this is the lateral margin of the arm, right? So the deltoid, so now I have the upper arm like this, right? Blocking like that, right? The deltoid arrives a little bit at kind of the level of the end of the pectoralis here, right? So that's the deltoid here. And now I know what it gets to, right? That's the deltoid. So look how this part here is divided in 3 segments. 1, that's the acromion, right? 2, that's the body of the deltoid. And 3 is a tapering deltoid. 1, 2, 3, like that, right? From here, I go up to the armpit, and that's the deltoid. Makes sense? So now when we break it down like that, we can measure it. We can really have an idea of how big that part of the body is and how it relates to other parts of the body. That little dimple there is where the Delta-Pectoral Triangle is, which is a little bit to the left of the nipple. So it's here, right? And now we have a bicep here, right? We have here the tricep, which is bulging out like this, and then the lower part. So half of it, half of this length here of the tricep is for the of the side of the arm is for the tricep here, and then the lower part is probably the tendon start becoming visible. And a 1 and 2, right? So now here we would have the lateral margin of the forearm is almost vertical. See that? Almost vertical. So we could do this from here, peaks, right? Peaks at the level of the triangle of the bicep here, and then from here goes down straight like this to down to the genitals here. That's the rest, right? So now from here we go peak. This peak is lower. See that? This peak is higher. This peak is lower. See that? 1 and 2. See that? 1 and 2. Right? So we capture the sense of geometric aspect of the figure, right? Then we can block in the brachioradialis. We can block in. This is the tendon of the thumb, right? This is the thumb, right? So that this volume here, right? Tendon and muscle of the abductor and extensor of the thumb. And it goes across like this, right? The flexor goes behind the radius right here. So we have this overlapping, right? And here I have also change of angle. It can be more specific now. This is brachioradialis, extensor, and then the ulna. So that's the ulna, right? This is the bump of the ulna. So that's the ulna, right? And it goes straight like this. So now we have 1 little bump, right? 2, a bigger bump, and then the ulna. So I have to start breaking down these in more specific angles, right? So again, now we haven't seen all the muscles, so it's going to be a little bit difficult to identify them. But what I want you to practice is to start seeing, identifying all these bumps, right? Even if we don't know the name, we will know the name. We have 6 sessions, so we're going to see a lot of muscle, right? So notice how these forms, this volume, with this method tend to be sculpted. I tend to be kind of sculpted like that, right? This method is called Florentine structural system, but also architectural or sculptural method, because you think of sculpting the forms of the body more than copying the outline of the body, right? So the hand is here now, right? So we have this angle here. See that here? Look at this angle compared to the vertical, right? Imagine the vertical here. The lines, those outlines that are so sculpted. Now we start. So I have a path from here to here, right? But if I look carefully, I see that the passage is not so abrupt. Now we're going to pay attention to make smooth it a little bit more right here, and then flat, kind of slightly convex, and then down here, a curve like this, and then from here I have the deltoid coming up like this, right? Let me enlarge this, right? And then from here I have the tricep going up like this, right? And then going down, and then flatten, and this is the bicep, which goes down like this, and gently curving in. And this is now the brachioradialis comes in over here because it stems from the side of the arm like this, and it has this little bump here, right here, 1 and 2, right? And then from here, it doesn't go there, it goes here, right? That's the brachioradialis. And from here, the extensor, right? And then comes in, and then this is now the ulna. And this is now the tendon goes in. This is now the flexor, and this is the bump of the flexion. This is the tendinous portion, and this is now the extensor of the thumb and the radius. And so now we create a much cleaner line drawing. See that? Much cleaner line drawing that it doesn't have to be dark. I'm making it dark because we need to see it, right? And this is the sternal oblique, pectoralis, right? and now have the here the iliac crest and iliac spine, the side with the gluteus medius and the tensor fasciae lata. This is this is the trochanter, right? See how it gets cleaner and cleaner right now, right? It gets cleaner and cleaner. So try to do this now. Try to go over this drawing that you did, and then refine